at around about 5:30 on January 12th, 2010. I just landed from London and got a call saying that there had been an earthquake in Haiti. All of us came together very quickly, realizing that it was a major event. So we had spent years building a platform in healthcare in Haiti, and we had systems in place, and we had stuff in place. We had a supply chain, we had folks in customs, we knew people at the airport, we had thousands of Haitian colleagues. As a result, they were able to smoothly respond to this massive crisis and move a lot of supplies quickly from the sites where we operate in rural areas to Port-au-Prince. In the immediate aftermath of the earthquake, we were focused entirely on the emergency response. All of our Haitian clinical staff, in spite of knowing many people, close family and friends who died or were badly injured in the earthquake, made sure that they went to help set up the medical facilities in all of these camps. And every single one of them, whether in the camps or staying out in the rural areas, to make sure that we had the kinds of field hospitals and operating rooms and supply chain to those, to make sure that we could take care of patients that were coming actually by the carload every single day for weeks and weeks after the earthquake. For our midterm plan, we wanted to make sure that we could really focus on longer-term solutions for shelter, for foreign aid and channeling funds and the generosity of many, many, many Americans and people around the world, to make sure that those funds and that support actually were able to be translated quickly into the sort of help that was needed around Port-au-Prince, and then quickly, as people began to leave the city, to make sure that they had options for housing and building a new life outside the city. For the longer term, we made some really important investments in the medical infrastructure and medical education infrastructure. We were able to really put a lot of thought and emphasis on medical education, which we felt would be the key to succeeding in building back the strongest. It's impossible for me to go back to Haiti and not think about 5 years ago, when things looked so bleak and desolate and dark, and there was so much destruction and damage. It would be easy to think that it would be hard to recover from this kind of destruction. And yet now, only 5 years later, I see so much good, productive work rising from the ashes of that time. Whether or not I'm at a clinic site or on a home visit, and certainly at one of the major hospitals there, knowing the enormous effort that has gone into rebuilding and building in a different way, building with the future in mind. It's extremely hopeful and optimistic. The earthquake in many ways gave us an excuse to build and do things even more ambitiously.